Hi everyone, I am Shahan Layek. Welcome back to my channel, and this is the first video of our 100 day 100 disease series where we will be discussing every day one new disease. So today we will discuss about vestibular schwannoma. Vestibular schwannoma. This is our first day disease. So let us learn about vestibular schwannoma. This is a very important disease, and it came several times in PLAB examination, and it came in NEET PG examination, USMLE examination. So it is always asked. It is one of the favorite topic of the examiner. So what is vestibular schwannoma? Basically it is eighth cranial nerve palsy. Eighth cranial nerve palsy. Remember this, very important. It is always asked in the MCQ. Eighth cranial nerve palsy. Basically what happens, you get a intracranial tumor. So you get a tumor, and this tumor happens in which part of the body? It happens in the squam cells. It occurs in the squam cells. So you get intracranial tumor in the squam cells, and this kind of tumor has a characteristics that it grows very slowly. So it grows very slowly. This is one of the important characteristics of these kind of tumors. It grows very slowly. Another thing which is very important is they may be very large. They may become very large before any symptom develops. So it may become very large, it may become very big before any symptoms develop. So this is one of the very important characteristics. So you have to remember this vestibular schwannoma is eighth cranial nerve palsy. This basically occurs due to intracranial tumor that develops in the squam cells, and that is why the name is vestibular schwannoma. So why the name schwannoma? Why the name schwannoma is there? Because you have tumor in the squam cell. You have tumor in the squam cell, and that is why you are getting vestibular schwannoma. So always remember, eighth cranial nerve is getting the palsy here, and this is also known as aquastic neuroma. This is also very important point for your examination. This is known as aquastic neuroma. So another name of vestibular schwannoma is aquastic neuroma. So another name, sometimes they do not give the name vestibular schwannoma, they give aquastic neuroma. That is the same thing that occurs in the squam cell, always remember, and it grows very slowly. And it develops into a large tumor, and after becoming a large tumor, then only you get the symptoms. Before it becomes large, you do not get any symptom. This is one of the characteristics of this kind of tumor. Another thing which I will be discussing is what is the symptoms. Basically, what symptoms do you get, which is very important. You get deafness, you get headache, you get severe headache. This is very important. And you also get ataxia. Ataxic gait, and you get tinnitus. Diplopia. You also get double vision, diplopia, and sometimes you may also develop facial paresthesia. So what are the symptoms you are getting? You are getting deafness, you are getting headache, you are getting tinnitus, diplopia, and ataxia and facial paresthesia. These are the important symptoms of vestibular schwannoma, also known as aquastic neuroma. Very, very important. Vestibular schwannoma, also known as aquastic neuroma. It is eighth cranial nerve palsy. Very, very important for your MCQ point of view. And how actually it is presented in the MRI. So when we do the MRI scan, we get a tumor. The tumor reveals itself at a particular place, which is also very favorite question for the examiner, very favorite topic to be asked, and that is the tumor is located at cerebellopontine angle. So the tumor is located at the angle between cerebellum and pons, so this is known as cerebellopontine angle. This is the angle in which if you do the MRI scan, you get vestibular schwannoma, cerebellopontine angle. So let us discuss about a case which is also very, very important, because nowadays always case-based questions are asked. So let us discuss about a case. It is a case of 68 years old man, and the man complains of progressive hearing loss. So the man was complaining of hearing loss, and it is progressing day by day. The man was also complaining of ringing in ears. So the man was also having ringing in the ears and having facial pain. So the man was complaining three important. Basically the facial pain was in the left side of the face. So the man was complaining of the three important thing. He was having hearing loss, he was having tinnitus, that is ringing in the ears, and he was also having facial pain on the left side. So when you inquire this patient, when these things happens, the patient told that it started 1 month ago. So it started 1 month ago. And when you do the physical examination, when you physically examine the patient, you understand the patient is also having the unsteady gait. So the patient is also having gait problem and decreased hearing. When you do the hearing test, you find out that the patient is having hearing problem, decreased hearing in the left ear. So all these findings you are finding in the physical examination: unsteady gait and decreased hearing in the left ear. So when you are checking the eye movement, you got to find out that his eye movement is completely normal. And what about the facial sensation? And his facial sensation, the senses that is there in his face, that was also completely normal. And what about the facial movement? The facial movement he was having, when you check the movement of his face, that was also normal. So facial sensation normal, facial movement normal, eye movement normal. So what was the problem? The problem was hearing loss, ringing in the ear, facial pain in the left side, unsteady gait, decreased hearing. All these are problem. But everything other than this, like the eye movement, facial sensation, facial movement, everything is normal. So when you ask the patient to do a MRI, you do MRI of brain. So what you get? You get that the patient is having tumor. At which angle? I told you, at CP angle, that is cerebellopontine angle. So in MRI of the brain, you got to know that he is having a tumor at the cerebellopontine angle. Cerebellum and pons, between that you have an angle known as cerebellopontine angle, and that angle is the place of vestibular schwannoma, also known as aquastic neuroma. Always remember this: 8th 8th cranial nerve palsy. Let me summarize all these things what you have learned. Vestibular Squanoma, also known as Aquastic Neuroma, 8th cranial nerve palsy. It happens in because of intracranial tumor that develops in the squam cell. It grows very slowly. You get deafness, headache, ataxia, tinnitus, diplopia, facial paresthesia, all this. And when you ask the patient to do a MRI, you will get a tumor in the cerebellopontine angle. So you can understand this is a case of vestibular schwannoma, also known as aquastic neuroma, 8th cranial nerve palsy. So this is the end of this video. If you like this video, make a thumbs up and subscribe our channel for getting many more videos like this. Thank you so much for watching. Have a nice day. Bye bye.